Hello, I'm Dr. Craig Barnett with Merck Animal Health.
And I'm Dr. Amanda House with the University of Florida College of Veterinary Medicine. And today we're going to talk about a really important topic, especially for this time of year for our horse owners, and that's spring vaccines. Some equine infectious diseases are significant enough to justify vaccination for every single horse across the country every single year. And these are called the core equine vaccines, as defined by the American Association of Equine Practitioners. The core equine vaccines protect horses against Eastern and Western equine encephalomyelitis, tetanus, rabies, and West Nile virus. And while the clinical signs and symptoms can vary, most of these diseases cause neurologic symptoms, which can be devastating for our horses.
And in addition to the core vaccines, we have what we call risk-based vaccines. And the decision to use these vaccines is based on the risk of that particular horse contacting that disease. Equine influenza virus and equine herpes virus are two of the most common risk-based vaccines we give to horses, especially to horses that travel and show are in frequent contact with a lot of other horses because they're at increased risk of contacting these diseases. We highly recommend horse owners consult with their veterinarian regarding risk-based vaccines and which ones they should consider giving to their horse. We've seen, speaking of risk, we've seen a lot of equine influenza lately this past year in horses. Equine influenza in horses, like in humans, has a tendency to undergo antigenic drift or change or mutations in the field. We've been monitoring these mutations through the Merck biosurveillance program the last few years and have seen significant antigenic drift or significant change in the virus in the field, resulting in frequent outbreaks across the U.S., even in well-vaccinated horses, highlighting the need to update our vaccines. During one of those big outbreaks in Florida, we were able to isolate a very virulent pathogenic strain called Florida 13. Merck Animal Health incorporated that Florida 13 strain in their Prestige influenza vaccine line to help provide better protection to horses. And you can find out more information about that at prestigevaccines.com. Horse owners can also find additional information about vaccinations by going to AAEP, the American Association of Equine Practitioners website, aaep.org. And in addition to vaccinations, how about additional things that horse owners can do, Dr. House?
Absolutely. In addition to vaccinations, good biosecurity management practices are absolutely critical. And this includes things like taking your horse's temperature daily, because a fever can be one of the first signs of infectious disease. Of course, good hand hygiene practices, so washing your hands well with soap and water before contacting different horses. Additional practices include things that will reduce nose-to-nose contact between horses and reduce the use of shared or communal equipment and water buckets. It's also a good practice to try to remember for horses that are being newly introduced to the farm that you may want to isolate them from your other horses and monitor their temperatures and monitor them for other signs of potential infectious disease. There are a lot of great suggestions on biosecurity practices at the equinediseasecc.org website.